Hi, this is Dr. Kate Eckert, and I'm going to talk a little bit about diastasis recti today. It is something that people come into the office and want to know more about. Do they have it? How should they proceed with getting back into activity? And those kind of things. So if you don't know what diastasis recti is, it is that splitting of the abdomen right along the center, and it can be anywhere from where your sternum ends, that xiphoid process, all the way down to your pubic bone. So you can have it along that center line. It's called the linea alba. It's that tendinous intersection between left and right rectus abdominis. So that would be your six-pack muscle. And the other thing to keep in mind is that that linea alba is also that center line that is also a connection point for the aponeurosis of three other abdominal muscles. And that's just a tendinous attachment. So we've got external abdominal oblique, which is the most superficial. So that's actually covering our six-pack muscle or our rectus abdominis. So that's really your most superficial outer abdominal muscle that we're talking about attaching into the linea alba. And those fibers orient with, if you were to put your hands in your pockets, they're facing that direction. Next layer for the abdomen is the internal abdominal oblique. Now, that's a little bit tricky because for the aponeurosis of that muscle, it's going to split. So half of it is going on the front side of the rectus abdominis, and half of it, the aponeurosis, is going on the back side. So it sandwiches around your rectus abdominis, and then it attaches into the linea alba with that tendinous insertion. Behind that is your TVA, so your transverse abdominis muscle. And if you have diastasis and know about it, then you've probably seen that a ton, the TVA and doing things like TVA holds and whatnot to help with rehabbing your diastasis. And I think it really often gets overlooked when you're focusing so much on that TVA. We forget about the importance of IAO, so the internal abdominal oblique, because it has, we'll talk about it a little bit later here, but it plays a big role in how bringing better intra-abdominal pressure to that front line section. So you have those layers of the muscle. So external abdominal oblique, totally on the front side. IAO, internal abdominal oblique, splits itself. It sandwiches that rectus abdominis, attaching at that midline, both sides. And those fibers are, if you had your hands in prayer, those fibers are coming up that way. TVA is most deep to that, and it goes behind. The other thing to keep in mind with those abdominal muscles, rectus abdominis runs perpendicular to the floor, and it's only on the front side. IAO, EAO, and TVA wrap around the torso and attach to some fascia in the low back as well. So I want you not to think of it as just a front-sided muscle, but think of it taking its importance all the way to your low back. So if you're thinking diastasis recti, think possible issues and dysfunction in your low back as well, because those muscles are also heavily affecting in how we support our low back and how it attaches into fascia and structures or into the low back as well. So you often have these other symptoms coming from your diastasis that you might not even realize are maybe attributed to your diastasis. You could have pelvic floor dysfunction, you could have organ prolapse made worse by that, you could have hernias that occur that are making you more susceptible through your diastasis. You could have incontinence, stress incontinence, urge incontinence. You can have painful sex, those kind of things. So diastasis, most people come in because they want the aesthetics of it fixed, but it's also going to play a huge role in your function, and you might not even be aware of it. I work with a lot of yogis, and when they want to get back into their yoga practice, there's a lot of things that I recommend to stay away from initially when you have a diastasis that involves crunching and certain exercises that will make it worse until you manage to properly create intra-abdominal pressure. So if you're a yoga person, things like Navasana, or even going from up dog to down dog, where you roll over your feet to get to down dog, that is a type of crunch and contraction in itself, and that can make your diastasis worse as well. So those are some things that you want to make sure that you've rehabbed well before you jump right back into that. With diastasis, one way to look at um, starting to rehab it is not so much by thinking of closing that gap, but it's learning how to let your pressure go other places. So if you are having that widening, that doming, those kind of things when you go to sit up or you crunch up, those kind of things. Think of it as all of your intra-abdominal pressure is coming out one weak spot where that linea alba is. So you want to make sure that your pressure is able to go into all the different areas of your torso in like a 360-degree area. So a lot of times working on better rib mobility and better lateral breathing will help to disperse that pressure in a more even manner. So, in a lot of my videos and that kind of thing, I use a porous ball quite frequently to warm up the rib cage, get better lateral movement, work on the sides of the body. So when we use the porous ball between the ribs and the top of the pelvis, that is targeting that lateral aspect of EAO, IAO, and TVA, and going all the way back to the low back and doing what we call thoracolumbar fascia release, which is that big, dense patch of fascia in your low back that has some attachments into those abdominal muscles. So things like working with tools such as a Pilates ball or porous ball, those kind of things can be super helpful in getting better movement and breath into those areas. The other thing is with teaching someone how to breathe better. Um, People will say, let's diaphragmatically breathe, and not knowing maybe how to do that, they're just going to start breathing into their belly because we tell you to keep your chest relaxed and keep your shoulders down, and they don't know exactly what that looks like. So instead of breathing in a 360-degree fashion, because they might be very restricted in their rib cage and in their sides, they breathe out anteriorly. So they're breathing out through the front. And where do you have that weakness? You have it at your linea alba, directly in the front of your body. So that can make your symptoms associated with your diastasis worse. So if you have organ prolapse, stress incontinence, painful sex, pelvic floor dysfunction, if you do that belly breathing where you're over and over increasing the pressure where your linea alba is out the front, it can make things worse. So really doubling down on learning how to get good mobility of the rib cage, breathing laterally. If you think of how the rib cage is oriented, our ribs kind of swing down in like a bucket handle fashion, and you want to think of those ribs as swinging out into the side. So that lateral movement, think of the lower ribs because they don't circle all the way around, those false ribs or the N2 or their floating ribs. Think of breathing into that posterior side, breathing into the back side where we tend to get bound up. That is really a key place to start. So initially, if somebody comes in with diastasis and we're like, oh, we're going to work on breathing, it doesn't sound very exciting. It does not feel like they're going to get that goal of maybe aesthetically bringing that back, but it's going to give you your function back quicker by addressing better overall pressure management of the core. And there's lots of different tools out there. There's a Core 360 belt that I've used in the past. It's an elastic belt that you wear around your waist, not a supportive thing. There's knobs in it. So as you inhale and you're trying to expand 360 degrees, you're looking for the pressure in the front and the back and making sure you feel equal pressure in those 4 ball things that are in the belt. If you don't have one of those belts at the office, I'll just have somebody put a yoga strap around their rib cage, have them do their breathing, and I want them to be aware of how it's tightening. So if you're only feeling the tension in the front, you want to try to breathe laterally into the back. So that's a good tactile cue to see how am I breathing naturally? What are my tendencies? That kind of thing. And I'll even have people wear it. When I used to teach in person a yoga class, I would have students wear it for the whole class. And when you're in different yoga poses and you're twisted and perhaps not maybe holding your breath or not breathing fully and thinking of that 360 breath, it's a nice cue throughout a class to see where is my breath going. So rib mobility and proper breath is definitely the starting point for where I like to go for diastasis issues. And I am working on a 6-month course coming up here at the end of the summer to be a core to floor restoration. So working through the consistency of breath work and core and mobility to address diastasis recti, pelvic floor dysfunction, and C-section rehab, because they're all very tied together. Now, I've talked a lot, it seems like, in this episode so far about diastasis for post-pregnancy, but I don't want to neglect the fact that it is not a pregnancy problem all the time. 2/3 of pregnancies have diastasis, and they, some repair on their own, some need this kind of rehab to fix, and but it's not just for pregnant or postpartum moms. I have lots of men that have diastasis recti issues. It could be from gaining weight too rapidly. It could be from lifting things too heavily. It can be from having that lack of rotation, or we tend to be linear movers and moving front to back all the time, and we don't have great mobility here. So if this is bound up and your pressure only has one place to go, and you exert yourself really intensely, like by lifting something very heavy, you can have that splitting of the linea alba down the front. So it's definitely not just for postpartum moms, and it's not just for women. I see it across the board. I myself was really into working out and didn't do it symmetrically when I was in undergrad, and gave myself a small diastasis from doing improper core work. And you can definitely heal that up on your own. And one thing also I would like to point out is that most babies are born with diastasis recti. That's just kind of how they come out, and they almost all, I'd say, I don't even know what the percentage is, but almost all of them resolve that on their own by how they develop and move throughout, going from not being able to pick up their head, not being able to roll over, not being able to crawl, all those um, movements that they learn, rotational stuff, um, learning to come into that dead bug type of position, coming into bear pose, coming into oblique sit, those kind of things. That is how they rehab themselves just by the nature of learning to move. So, a lot of the ways that I work with patients in the office is by mimicking what babies do to rehab their own diastasis from birth. And that is a lot of what DNS is. Dynamic neuromuscular stabilization is a type of um, rehab technique based out of Prague that we use in the office. And it works really well, and it goes by that theory of breaking down movement and working through those developmental patterns to give the best movement possible. So if babies can do it, if you've done it once already in your life, you can definitely get better uh, movement and intra-abdominal pressure twice in your life. So I wouldn't be too discouraged, especially to some people say, oh, it's been 5 years, it's been 10 years since I've had this. It's too late. It's not too late. You can always make good change, and you can work on your breathing and work on better rotational stuff in your rib cage, and work on distributing that pressure better. Another thing to look for with diastasis is that if you have a diastasis, it means you have a pressure problem in your abdomen. So it makes you more apt for, again, I said, the low back issues, pelvic floor dysfunction, stress incontinence, all those things, but also hernias along the abdomen. So if you have a pressure issue in one place, you've really got to address it, or you're going to probably end up with some kind of symptom that you might not even think is associated with it down the road. Another thing that I didn't mention earlier would be, how do I know if I have a diastasis? You can go to a provider and get assessed by them, or you can lie on your back. You can locate your linea alba, so you come to the bottom of your sternum, and then you palpate or with your fingers down along that center line. And what a provider is looking for when they're assessing it is finger width space between each side of your rectus abdominis. So, we measure it 1, 2, 3 finger widths wide, and then we're measuring it finger widths deep. And we're trying to also assess the tensegrity, or the strength of the linea alba. What is the texture of it, and how strong does it feel to accommodate an increase in pressure at it. You can also have them do a crunch up, and that is going to show us how they accommodate that pressure. Is there doming? So that would be doming, or coning is where it bumps up at a different point, and you're going to assess all the way down the linea alba, looking for any abnormalities at that center line. And so that is how you assess for diastasis recti, along that center line, seeing the tensegrity of the linea alba, finger widths across, finger widths depth-wise. And the goal isn't to necessarily close the gap, but it's to be able to better manage pressure and work with how that linea alba holds up against pressure pushing against it. So we're trying to improve the tensegrity, maybe not so much close the gap. And that is going to give you a lot of functional benefit and maybe clear up your low back pain, pelvic floor dysfunction, incontinence, those kind of things, prolapse, but also prevent it from happening. So once you've assessed yourself, discovered you had a diastasis issue, discovered you do have a diastasis issue, then you look towards the better breathing, better the rib cage mobility. Next step is working to activate and use your other abdominal muscles, the transverse abdominis, the internal abdominal oblique, and the external abdominal oblique. And we'll get into those exercises through the course I'm putting together, but I do have stuff on my Instagram and TikTok and our private group for Just Breathe on Facebook that goes through things like activations and mobility and the whole gamut. So I'll have it kind of in a nice, neat little package with our course, but you can find that information through my social media. And, I really hope that if you think that you have something going on, you can also reach out to a provider, because this is in no way diagnosing you, because I can't see you myself or anything like that. So if you think you have an issue and you're having symptoms, you should definitely get assessed. So again, this doesn't replace assessment, but just giving you more information and maybe looking at diastasis recti through a different lens. Because sometimes when you're going to your PCP or your OBGYN, they're not super well versed in the rehab aspect of what that looks like. And there's lots of different schools of thought on how to address those issues. And, there's not a ton of great research out there. So it's kind of trial and error and what works best for your patients. And every body is a little different. So just wanted to give you another resource, another lens again, to look at the diastasis recti and how it can affect so many different aspects of your body, and not just the aesthetic aspect, because aesthetics are always nice. I like to look nice, but not being able to pick up your kid because your low back is spasming, or not being able to jump on a trampoline because you're having leakage is also depletes your quality of life. And one thing with this podcast is I want it to increase people's quality of life and let them return to the activities that they love. So if this is holding you back, I want to give you some options and some tools and let you know that it's not too late, even if it's been a couple decades, to address this kind of stuff. So if you have any topics that you'd like covered down the road, let me know. I'd be happy to talk on it or find someone to interview that is more of an expert on the issue.